In the silent whispers of your home, a feline drama unfolds, a tale where hyperthyroidism in cats commandeers the narrative. This ailment, marked by an overzealous thyroid, can orchestrate a profound metamorphosis in your beloved pet. Picture this: once lustrous coats become lackluster with hyperthyroidism and cat hair loss, vibrant cat eyes now mirror the malaise within, and the robust energy of your companion dwindles into fatigue. Recognizing the early signs of hyperthyroidism in cats is pivotal. Increased appetite paired with inexplicable weight loss, a once serene gaze replaced by angst. You may find yourself pondering, how long does a cat live with hyperthyroidism, or what triggers hyperthyroidism in cats, and crucially, are cats in pain with hyperthyroidism? Your quest for knowledge signals a profound desire to alleviate this hidden suffering. It is here, in this nexus of concern and curiosity, where we delve into the realms of hyperthyroidism in cat treatments, traversing from traditional medication to burgeoning natural treatment avenues. There is solace in understanding and power in action, whether modifying hyperthyroidism in a cat's diet or assessing cutting-edge remedies. Our journey through this intricate landscape of feline health is not merely academic, it's a voyage towards regaining the effervescent spirit of your feline friend. Let this exploration be your compass to navigate the tides of hyperthyroidism in a cat's symptoms and treatments, empowering you to write the next chapter in your cat's life. The rising concern of hyperthyroidism in felines as the most prevalent endocrine disorder in middle-aged and older cats. Hyperthyroidism has escalated to a point where its recognition and control are paramount in preserving the health and longevity of our feline friends. Overview of what hyperthyroidism in cats entails. Hyperthyroidism is a condition characterized by the overproduction of thyroid hormone by the thyroid glands. The ramifications of this hormonal excess are systemic, influencing multiple organ systems and manifesting in a myriad of clinical signs. Understanding hyperthyroidism. Defining hyperthyroidism in the feline world. In the feline sphere, hyperthyroidism predominantly results from a benign growth on the thyroid gland that secretes excessive amounts of thyroxine, T4, and triiodothyronine, T3. How hyperthyroidism affects a cat's body. Elevated levels of thyroid hormones escalate metabolic processes, engendering a state of hypermetabolism that can have harmful effects on a cat's health, ranging from cardiac hypertrophy to profound metabolic disturbances. Recognizing the symptoms. Early warning signs of hyperthyroidism in cats. Identifying hyperthyroidism early hinges on recognizing symptoms such as increased voracity juxtaposed with weight loss, hyperactivity, and augmented water consumption and urination. Behavioral changes. More than just mood swings. A cat's behavioral alterations, including irritability, restlessness, and diminished tolerance for interaction, can be subtle harbingers of thyroid disease. Physical signs. From weight loss to poor coat condition. Physically, a cat may exhibit a disheveled coat, tachycardia, and gastrointestinal disturbances indicative of an underlying hyperthyroid state. Causes and risk factors. Investigating the causes of feline hyperthyroidism. The exact etiology remains elusive, yet studies suggest environmental, dietary, and genetic factors may all contribute to the pathology of this disease. Age and lifestyle. Are certain cats more at risk? Predominantly, geriatric felines are afflicted, raising questions about the role of chronic exposure to potential environmental goitrogens and dietary constituents in the pathogenesis of the disease. Diagnosis of hyperthyroidism in cats. Steps to an accurate diagnosis. Beyond the symptoms, diagnostic acumen requires an astute consideration of clinical signs corroborated by laboratory tests and diagnostic imaging. The role of T4 levels in diagnosing feline hyperthyroidism. Serum total T4 concentration is the cornerstone of diagnosis, although additional tests may be required to differentiate from other conditions with similar presentations. Imaging and tests. A closer look at your cat's thyroid health. Technetium scintigraphy and ultrasonography serve as ancillary yet pivotal diagnostic tools, rendering a window into the structural and functional status of the feline thyroid gland. Treatment options. Explored medication management. Pros and cons. Antithyroid drugs like methimazole offer a non-invasive treatment modality, albeit with potential side effects and the necessity for lifelong administration. Radioactive iodine therapy, a modern approach considered the gold standard. Radioactive iodine therapy promises a high probability of cure with minimal invasiveness, yet requires specialized facilities and containment protocols. Surgery for hyperthyroidism, is it suitable for your cat? Thyroidectomy provides another curative option, albeit with inherent surgical risks and the potential for postoperative complications. Diet and hyperthyroidism. Nutritional strategies to manage hyperthyroidism. Dietary management, emphasizing iodine restriction, has emerged as an adjunctive or standalone intervention in specific feline populations. What to feed a hyperthyroid cat? Foods that help. Prescription diets formulated to curtail iodine intake can aid in managing hyperthyroidism, provided comprehensive dietary adherence is achieved. Living with hyperthyroidism. Daily management of a cat with hyperthyroidism. Management entails meticulous medication dosing, dietary regulation, and fostering an environment conducive to the well-being of a hyperthyroid cat. Quality of life, balancing treatment and comfort. The ultimate goal remains to harmonize medical management with maintaining a high quality of life, ensuring comfort and contentment for the afflicted feline. Monitoring and follow-up. The importance of regular checkups and T4 monitoring. Post-diagnostic vigilance is paramount, necessitating regular veterinary assessments and T4 level evaluations to fine-tune treatment protocols. Adjusting treatment, when and why. Treatment regimens may require adjustments, contingent upon the dynamic interplay between medication effects, dietary compliance, and the cat's clinical response. Complications and considerations when hyperthyroidism in cats goes untreated. Unchecked hyperthyroidism can precipitate grave complications, such as hypertrophic cardiomyopathy and systemic hypertension, which can irreversibly affect a cat's health. Hypertension and heart disease, the silent accomplices. The stealthy onset of secondary hypertension and concomitant heart disease in hyperthyroid cats underscores the necessity for prompt diagnosis and intervention. Holistic and alternative therapies. Exploring holistic approaches to managing hyperthyroidism. Holistic modalities, though less conventional, may offer supplementary therapeutic benefits, enhancing the overall treatment landscape. Acupuncture and herbal remedies, do they work? Emerging anecdotal evidence hints at the potential efficacy of acupuncture and herbal remedies, yet empirical research still needs to be explored. Support and resources for owners. Support networks. You're not alone. Owners grappling with a hyperthyroid cat's care can find solace and support in networks that share information and experiences. Financial planning for your cat's hyperthyroidism treatment. Navigating the financial aspects of treatment requires planning, with options ranging from insurance coverage to assistance programs. Innovations in treatment. The future of hyperthyroidism treatment in cats. With continuous advances in veterinary medicine, the prospect for innovative treatments is promising, fostering hope for more effective management strategies. Clinical trials and research. What's on the horizon? Ongoing clinical trials and research endeavors are pivotal in sculpting the future framework for feline hyperthyroidism therapy. Prevention strategies. Can hyperthyroidism in cats be prevented? Although outright prevention may be challenging, mitigating risk factors through environmental and dietary modifications could prove beneficial. Conclusion. Recap of vital insights into hyperthyroidism in cats. In culmination, this discourse has sought to demystify feline hyperthyroidism, illuminating its nuances and emphasizing the salience of informed, proactive management. Encouragement for proactive health management. The stewardship of feline health commands a proactive approach, advocating for regular veterinary assessments and an